Good morning, distinguished guests and colleagues. My name is Dr. Mayowa Alade, and I serve as the Chief of Staff to the Coordinating Minister of Health and Social Welfare. Today, I'm honored to present a project that I've been working on, which I'm passionate about, and that is critically important to Nigeria's health system. This is called the Resilient Women in Health Leadership, Empowering Young Female Health Professionals in Conflict-Affected Communities. This initiative presents a commitment not just to leadership development, but to addressing one of the most overlooked intersections in our health system today, that is the nexus of gender, conflict, and health leadership. Let me begin by acknowledging the reality we face. Insecurity in part of Nigeria severely limits access to health care and health service delivery. This is not news to anyone in this room, but what we must confront more directly is how this crisis disproportionately affects women. Women in fragile and conflict-affected communities face compounded barriers. They experience heightened health risk, forced displacement, economic exclusion, and critically limited leadership opportunities. Here's what troubles me the most. Existing leadership fellowships and programs rarely, if ever, address the intersection of gender, conflict, and health leadership. This leaves highly capable women health professionals without the targeted support they desperately need and deserve. The women serving in these communities are not just victims of circumstance, they are potential leaders, innovators, and change makers, but they are being overlooked, and our health system is poor for this. So my project aims to empower young women health professionals from fragile and conflicted communities with 4 critical pillars of support. The first one is on leadership and advocacy skills, because knowing how to lead and speak up for change is foundational. The second one is policy engagement experience, because we need these women at the table where decisions are made, not just implementing them. The third is psychological resilience and trauma-informed support, because working and living in conflict zones take a toll, and we cannot ask our leaders to pour from empty cups. And fourth, strong professional networks, because leadership is not a solo endeavor and connection is powerful. Overall goal of my project is clear: to enable women leaders to rebuild health systems and advance gender equity in fragile systems, not just to participate in the system, but to transform it. So now I'll go on to walk you through how this will work. The program or project targets young female health professionals from fragile and conflict-affected communities within the National Health Fellows Program Cohort 2. We are building on an existing infrastructure which makes this both strategic and sustainable. The project is built on 5 key components. The first component is the identification and recruitment from National Health Fellows Cohort 2. I've been able to identify and recruit 29 women from FCV regions already in the fellowship program. The second component is leadership and capacity building. This will be through structured training modules on governance, advocacy, health systems management, and public speaking. The third component is on psychological and resilience support. We provide access to mental health services, peer support groups, and trauma-informed care training. The fourth component is mentorship and coaching with senior women leaders. This will be a one-on-one mentorship from established women leaders in health and governance. We will be selecting mostly from women with similar background, so that these fellows can identify with them and also be able to open up and also learn from the experiences of these senior health leaders. And the last component is on policy and community engagement through real-world experience, using policy briefs, community health projects, and stakeholder engagement. This project is not theoretical. It is going to be a hands-on practical, and rooted in the realities of our fellows, that our fellows face every day. So, what will success look like? For us, we will train women fellows in leadership and to produce policy briefs and advocacy initiatives. But the real transformation comes from the 4 key outcomes. The first one is increased confidence and decision-making power for these young health professionals. The second is improved capacity to influence health policy in conflict-prone communities. Third is strengthened inclusive health systems in FCV regions. And lastly is to enhance the resilience and well-being of these young women leaders. And in terms of sustainability, we are building an alumni mentorship network, creating an online leadership hub, and planning for replication across additional conflict-affected regions beyond the Northeast into other parts of the country where we have pockets of conflict. This is not just a one-time intervention, but we hope that it will be a pipeline opening for building young women leaders in different FCV regions within the country. This fellowship is built on 4 pillars, which my project strongly aligns with. The first one is authenticity. The project is grounded in Nigeria's realities. That is, it's informed by direct experience with service delivery constraints and gender barriers in fragile settings. The second is inclusivity, which is we are being intentional about prioritizing women from conflict-affected communities who are often excluded from traditional leadership pipelines. The third is strategic design. This project is a health systems intervention which is leveraging the National Health Fellowship Program, and it's also engaging with federal and state authorities, development partners, and community leaders. And lastly, in terms of impact, we're building leaders who are supported, adaptive, and emotionally resilient, because we know that sustained impact in fragile contexts demands nothing less. In closing, I want to say this. Leadership is not a luxury in fragile settings. It is a necessity. And women leadership is not a nice to have. It is essential to health system resilience, to equitable care, and to lasting peace. The WomenLift Health Fellowship is our commitment to these women, to these communities, and to a stronger and more inclusive Nigeria. Thank you.